20 million people fill a prescription for erectile dysfunction in the US every month. But do those 20 million people know that they could be increasing their risk for vision loss? Viagra, Cialis, Levitra, Staxyn, Stendra. Together, these medications make up one of the most prescribed classes of medications in the US. Many are aware that these may cause some mild ocular symptoms, but what some may not know is that they may double the risk of 3 serious and vision-threatening eye conditions. I'll talk about which in a moment. Though most commonly used to treat erectile dysfunction, this class of medication can actually be used to treat pulmonary arterial hypertension as well. They work by relaxing the muscle that surrounds the arterioles in the body, so it allows the blood vessel to dilate. This increases blood flow to the desired area. The problem is, blood flow is redirected away from other parts of the body, which is one of the reasons why these medications are suspected to cause ocular complications. First, a serous retinal detachment can cause blurred vision, central vision loss, blind spots, distortion, changes in color vision, and sometimes flashes and floaters. It's caused by leaking blood vessels or swelling in the retina. It's thought that a serous retinal detachment may be more likely in those who take these medications because these medications increase vascular permeability, which basically means things can get in and out of the blood vessels more easily, which with all the blood vessels that are in the retina and behind it, you could see how they could begin to possibly leak in this case, which would cause the swelling. Common causes include infection, inflammation, trauma, age-related macular degeneration, among other things. It's important to know what other causes or risk factors are associated with these conditions. We'll talk about why in a moment. Treatment may include monitoring or stopping the medication if you're on it, laser, and intravitreal injections. Now, even if the condition improves, vision may return to normal, but this condition could have lasting effects even after improvement, like blurry vision or distortion, which can be really bothersome. One thing that I found really interesting was a case study where someone stopped the medication, their condition improved, and then they resumed the medication and the condition returned. I think it would be interesting to see if there are more cases like this out there to back up the validity of this particular case study. Retinal vascular occlusions come in 4 different varieties. They may affect the arteries or the veins, and they may affect the central artery or vein or the branches of the arteries or veins. You could see that if the central artery or vein is affected, the effect on the vision tends to be greater, whereas if it's just a branch, just a small area of the vision may be affected. These may come with a warning of transient vision loss called amaurosis fugax. This is where the vision may go dark for just a few moments and then comes right back, leaving a person wondering if that really did happen, and that's a very important reason to call your eye doctor and your physician. Many times, though, they don't come with a warning, and the symptoms are painless, sudden vision loss, usually in just one eye. The vision can go from being there totally to gone within seconds. The vision loss can vary depending on whether it was an artery or a vein or if it was central or branch, but it may range from just a loss of an area of peripheral vision to total vision loss. This would be counting fingers to light perception. Counting fingers is when you can just count the number of fingers on a doctor's hands. You can't read any of the letters on the chart, and light perception is like it sounds. You can tell whether the lights are on or off, but you don't have any vision otherwise. These conditions are usually only seen in those over the age of 60, but we've seen them in people who are much younger, shortly after taking these medications. More common risk factors for a retinal vascular occlusion would be high cholesterol, high blood pressure, diabetes. Notice all of these things can lead to atherosclerosis or blood clotting issues. There are many other risk factors as well. But what's important to note about these ones that I mentioned is that these are actual causes of erectile dysfunction. So you can imagine that if you could get these conditions under control or reduce these conditions or prevent these conditions with an improvement in a healthy lifestyle, then you may eliminate the need for erectile dysfunction medication altogether. So it's kind of interesting because if you have these health issues, you may be more likely to develop erectile dysfunction, you may be more likely to take this medication, you may be more likely to have one of these ocular events. But perhaps all of this could have been avoided from the start by preventing those conditions in the first place. So it's an interesting thought because you could either have both of these conditions or neither of them because they might be connected. Vision may remain stable, worsen, or improve slightly depending on many factors, but even if it does improve, it's unlikely for it to return to normal. Because vascular occlusions result in lack of oxygen to parts of the retina, the body responds to that by creating more blood vessels to bring more oxygen. But these new blood vessels are weak and can leak. This is called neovascularization. These new leaky blood vessels can cause a lot of problems and need to be treated, often with laser or intravitreal injections. So this eye condition could end up requiring a lifetime of management. Ischemic optic neuropathy causes symptoms of sudden painless vision loss, usually in one eye, but the other eye could be involved later on. Vision loss is usually moderate, and it may affect central vision or cause a visual field defect, usually altitudinal, which means it's either the lower half of the vision or the upper half of the vision that's all missing. The effect on visual acuity is really variable. Some may have vision better than 20/30, but some may be worse than 2200. Initial diagnosis of ischemic optic neuropathy usually occurs between the ages of 40 and 60, but it can happen in younger people too. It's not well understood what causes ischemic optic neuropathy, though there are some risk factors that have been found to be associated with the disease, though causation hasn't been proven. We'll talk more about the difficulties of proving causation a little later. The risk factors that have been found to be associated with ischemic optic neuropathy are high blood pressure, high cholesterol, sleep apnea, anemia, nocturnal hypotension, and a crowded disc, which means that the optic nerve is kind of small and it doesn't allow much space for the blood vessels to come through, so they may be a little bit choked out. And we can see that this all has to do with blood flow, which we're talking about when we talk about these male enhancement medications. Most cases are stable, but about 35% progress in the days to weeks following the initial event. Sometimes mild improvement may be seen over the course of a few months. That may be up to about a 3-line improvement on the visual acuity chart. Keep in mind that if vision is severely affected, 3 lines of improvement may not feel like much compared to how the vision was before the event. Whether vision loss is going to improve or progress, it typically stabilizes by about 6 months following the initial event. Also, it's important to understand and follow the dosage instructions of these medications. There have been incidents reported where someone has taken a higher dose than what is recommended and have shortly after had one of these ocular events. The silver lining is that all of these serious eye conditions are very rare to begin with, so doubling your chance of one of these conditions doesn't seem all that risky. But it certainly doesn't feel rare if it happens to you. Research in this area is ongoing. Though these medications have been found to be associated with these ocular complications, causation has not been proven. Now, proving causation can be a very complex process. Since these conditions are so rare, it's difficult to conduct a large study. Also, since many who take these medications also have other risk factors, high cholesterol, high blood pressure, it's hard to determine the cause or pinpoint that it was the medication and not another underlying risk factor. There have been studies, however, where otherwise young and healthy individuals have had one of these ocular complications shortly after taking one of these medications. If you gain anything from this video, I hope it's to take caution. There are many underlying causes of erectile dysfunction, though some of them can be improved by living a healthier lifestyle. If you can improve these conditions, it may reduce the risk for erectile dysfunction. And it also may reduce your risk for one of these other ocular complications in another way, since they are also risk factors for those. It's your body, they're your eyes, so you need to feel confident that you're caring for them as best as possible. If you found this video helpful, please click the like button, and I'd love to have you subscribe so you don't miss out on any essential eye health information. I think you'll like this one too. Thanks for watching.